Good morning, everyone. Good morning. I'm very excited about our conversation, which is appropriately titled A New Architecture for Heart Health. So I'm joined by two leading experts where we are going to discuss a bit about cardiovascular disease. As you heard, it's not only the world's leading cause of death, but it's one of the most persistent inequities in health. And we're specifically going to put a pin on hypertension and high blood pressure, which is very important. Let's get started. I'd love for both of you to talk a little bit about the burden of cardiovascular disease. It's a very multifaceted but interconnected disease. So, Paula, let's start with you because you kind of bring a global perspective.
Thank you so much. So I think we already heard that cardiovascular disease is still the world's #1 killer, but maybe it's useful to think about it in the context of non-communicable diseases, which cause about 70% of deaths globally. So cardiovascular disease, represents 30% of those. So it's really a huge burden and a public health issue. And many of the sort of cardiovascular, renal, and metabolic diseases are highly connected. So they share the same risk factors in terms of hypertension, obesity. And the burden in terms of individuals, families, communities is huge. But then also in terms of healthcare systems and economies. So when we look at the burden, the NCDs present, it's estimated that between 2010 and 2030, we are looking at $47 trillion. So that's kind of starts to show you the scale of it. And something like chronic kidney disease that's also has really high cardiovascular mortality. We're talking about 850 million people globally living with the disease. So I think that the numbers are staggering, but at an individual level as well, we know it causes many issues for people living with cardiovascular disease, their families and communities. So I think there's that sort of individual cost, but then when you look at the healthcare system cost and the economic cost, it's huge.
Rachna, would you like to build on that a little bit?
Yeah, absolutely. So Paula gave a great overview of the global context, and just to kind of bring it closer to home, here in the U.S., the CDC says that about half of adults in the U.S. are living with hypertension, and 3 out of 4 of those adults don't have it under control. And so what that means is, the majority of cardiovascular deaths in this country are caused by people who have hypertension and don't have it under control. And this touches every community, every family, really every person in the U.S. And there are solutions that we know that are tested, that are tried, and that are low cost, that can be used globally and here in the U.S. to get this epidemic under control, and to help people live healthier and more productive lives, which ultimately is good for our economy and our health, and our social lives as well. So that's just a little overview. I think the numbers speak for themselves.
Yes, thank you for level setting there. So, we really want to spend the bulk of our time in this short conversation about the need for bold solutions. And both of you are really acting as change makers in the space right now. So we really want to learn about what some of those initiatives are. Rachna, I'm going to start with you. At the CDC Foundation, the foundation has recently launched a new initiative, National Hypertension Control Program. So we'd just love to hear more about the program, the approach, the methodology, and what are you trying to accomplish here?
Yeah, thank you. So at the CDC Foundation, we've been doing cardiovascular health work for many years now. We've been working on communications campaigns. We've been working globally to help bring kind of low cost, high impact solutions to people in the US and globally. And we're incredibly privileged to be supported by AstraZeneca to launch a new program called the National Hypertension Control Program. And it's really building on some of our previous work and our previous successes. This program really aims to bring a 360-degree approach to the issue of hypertension. And so we're taking kind of a national, we're taking national best practices, nationally recognized approaches, and we're bringing them to communities and really working from the community level up to improve the issue of hypertension in communities. And so we're really focusing on patient-centered education, grassroots efforts, so working with community-based organizations and those locally that are trusted voices. So people in the community that people trust and believe in, we're really having them take messages forward about this issue. And then we're really focusing on intensive local action. So, clinical quality improvements in high-need areas. And we're really taking all of this to educate broadly within communities so that people can take control of their hypertension and bring their numbers down. So the CDC Foundation, we're located in Atlanta, Georgia, and we're incredibly privileged to pilot this program in Atlanta, in our home, in our community. And we are working deeply in Atlanta with clinicians, with community-based organizations. And what we're hoping to do in Atlanta is, improve the numbers on hypertension and then take the best practices to other communities, both here in the US and also globally, because the problems that we face here in the US are not unique to us. They're the same problems that other countries are facing as well.
Well, congratulations on launching such an important program, and we're going to come back to you in terms of some other learnings around that model. So, Paula, you also at AstraZeneca are working on a very innovative program, but it's been around a little bit longer than Rachna's. So it's 11 years old. It's the Healthy Heart Africa program. And what I love about what I've heard about it so far is it's really an integration care model, thinking about that connection between cardiovascular, kidney disease, and really infusing that into primary care. So again, just would love to have you kind of give us a flyover of what this model is, how it's working, what you've learned, and where you're taking it.
Yeah, absolutely. So Healthy Heart Africa, we started the program just over 10 years ago now in Kenya. And the idea was really to see how can we prevent and control hypertension, given it presents such a risk factor for cardiovascular disease, and prevalence of hypertension, is high in Africa like it is here in the US. And really with the program, we worked in 9 different countries, so different types of healthcare systems. But the program itself, it's really rooted in community. So working at the community level, integrating hypertension screening into primary care. And we've also recently expanded to include screening of chronic kidney disease, again, in the same community setting. And the way we have gone about designing the program is really doing together with the community. So having governments involved, ministries of health, civil society, medical professionals, patients, patient advocacy groups, coming together to kind of design the program and make sure it works for the local community. So it has many different components in terms of, disease awareness, education, training healthcare workers, conducting screenings, but also developing care pathways and protocols, because it's not helpful if we just screen patients. We need to make sure that their disease gets detected and then they get the care and treatment that they need. So we've really taken a holistic approach. And to date, we've reached over 40 million people. We've conducted over 30 million screenings. So I think over time, you can also get to the scale that you need to really make a dent in this disease. And as we think about the program, we really see there are 3 fundamental pillars there. So one is health equity in terms of targeting underserved communities, targeting communities where the disease prevalence is the highest. But then from a healthcare system resilience perspective, we really need to make these programs sustainable. We need to build capacity and capability, but over time, it needs to transition to the healthcare system. And, we're really pleased as well that we have governments now co-funding the program with us to make it really sustainable public-private partnership. And then the third element that is more recent is we're also looking at the environmental impact of disease. It's Climate Week here as well this week, and Unfortunately, with chronic kidney disease, when you get to the end stage of the disease, dialysis, it's extremely carbon-intensive disease. So we're looking at if you detect the disease earlier, you can change the trajectory of the patient, but actually you can also make a positive impact in terms of the environmental impact of care.
Wonderful. Okay, I want to go back to a comment that you made, Rachna, about community and trusted messengers. So in public health, we always talk about meeting people where they are. Have you thought about yet in launching this program who some of those trusted messengers are in the community?
Yeah, absolutely. You know, in every community that's different, but you know, we're really thinking about where do people go in the communities and who are the people that they trust. So a lot of times that's their pastors, that's someone in their church. You know, where can they get screenings? That can be in their barber shop. That can be in, you know, community organizations that they go to. But, you know, those of us working in this space, it's not necessarily the most helpful for me or someone else to, you know, get up on TV or on the radio and say what the problem is. If we can empower those leaders in the community to help take those messages forward, that's when they'll really be heard. You know, in some of the communications work that we've done previously around, you know, around hypertension and cardiovascular health, on the national level, we've also engaged, you know, comedians. We've engaged, you know, influencers. And these are the people that, you know, folks listen to and, you know, tune into. And so we want to just go to where people are and take those messages to where people are.
That's great. Yeah. So this is such a quick conversation. In the remaining couple of minutes, I'd like to talk a little bit more about sort of, you know, it takes a village and we really need to have strong public-private partnerships. You both are looking at this from global and domestic perspective, but I would love for both of you just to talk a little bit about the need of public-private partnerships. What does that look like, and where do we need to go with that?
Yeah, I think for us, you know, we've been working on this program for over 10 years, and we're committed to continue to do that. But I think for us, you know, it's really important that it's rooted in that sort of community. You have very early inclusive engagement, you know, with the local community, with governments and others to you know, to be successful and drive impact. I also think you need shared goals. Mm-hmm. So, you know, earlier this year, the WHO published a chronic kidney disease resolution that is actually calling for governments to take action on this disease. I think we just heard earlier this week the need to take action on hypertension. So I think it's also helpful that at the policy level, you know, we have these shared goals that governments are now committed to, and I think public-private partnerships can play a role in supporting the delivery of these goals.
Rachna, would you like to add to that?
Yeah, absolutely. You know, at the CDC Foundation, the work that we do is very much grounded in public-private partnerships. And, you know, none of us can do this alone. There needs to be public sector engagement. There needs to be private sector engagement. There needs to be research engagement. There needs to be engagement from community groups. And, you know, the people that this most affects needs to have a voice in the process as well. And so, you know, bringing all of those voices together and ensuring that we're, you know, everyone's bringing the best of what they do to the table, I think is really the only way to drive meaningful impact. We're really living in a world where resources are scarce. And so everyone bringing what they do best to the table is the best way to really drive the work forward.
Great. Yeah. So in closing out, is there anything that you would recommend? We have a diverse audience. We got a question about, you know, can startups get involved in this? Like, if there's any advice that you can give to our audience in terms of their engagement and what they can contribute, what would you say people can do?
I mean, I think it's, you know, there's huge opportunity to partner at multi-sectorial level, I think, on these disease programs. I think we've seen that, you know, it's not always, you know, you need strong public health community input, but, you know, if everyone around the table comes together, there's a lot that can be done together to, you know, kind of co-develop these solutions and achieve impact and scale. So I think we're welcoming definitely more partners to join us on this mission.
Okay. Well, thank you so much. This was great, and we wish you much success in both of these programs, and we look forward to learning more about them. So please amplify and get the word out so we can keep supporting you. Thank you, everyone.
Thank you.